Hi everyone, I'm Dr. Brant Larsen from Larsen Wellness Center, and in this video we're going to be talking about the gallbladder and gallbladder disease. Now, especially 17 symptoms of why you may have a gallbladder problem. Now, in this country alone, 750,000 surgeries are performed each year to yank out the gallbladder. Now, a lot of those people will say, well, you don't need your gallbladder anyways, it doesn't really do much, I mean, you can live without it. And my response is, yeah, I can live without my left arm as well, but I don't really want to. I want to keep it. The gallbladder was given to you for a reason. Okay, we're going to talk about that in this video. A review study in the British Medical Journal found that 50% of patients who had a gallbladder surgery didn't see improvement in their digestive health complaints. So half didn't even see improvement in their digestive health complaints. Now, the other half did. They saw symptom relief, but I can guarantee you this. They are now not digesting their food how they're supposed to anymore because your gallbladder serves several major functions in digestion. Unfortunately, the mainstream medical system has no solution for sluggish bile production, which is also termed biliary stasis. That's just a fact. They don't do anything for it. It's literally a watch and wait until the gallbladder gets so jammed with gallstones that it needs to be removed. So you're in searing pain, okay? And you have so many gallstones in there that you have to get that thing yanked out now. Again, I heard a long time ago, you can never take back a surgery, and I think that is so profound, right? We need to do everything we can to not have gallbladder surgery. Now, if you need a surgery, if you're at that point already, sure, have the surgery. Everyone pretty much after age 40 has gallbladder dysfunction. Okay, and there's reasons for that. So bile is an important digestive fluid that is produced by the liver. So the liver makes it, and it stores it in a concentrated form within the gallbladder. So if you have gallbladder dysfunction, you have a liver problem as well. And just taking out the gallbladder, yes, it takes away pain and symptoms and things, potentially, but you have to think a little deeper than that. Why was my gallbladder a problem? Was it actually dysfunction in the gallbladder, or were there things happening in my liver as well? And the latter is definitely the case. Bile has 4 major functions. Number 1, fatty acid metabolism. We need to digest our fats. Okay? And a lot of people say, well, I don't want to absorb fat. Right? I want to be skinny, I want to lose weight. But trust me, you need to absorb and digest fat. Eating fat does not make you fat. It's a complete anomaly. People think that if you eat fat, you're going to be fat. No, this is not the case. You eat sugar, you're going to be fat. You eat fat, you'll burn fat. The right kind of fat, though. It's critical for emulsification. So bile, your gallbladder, it's critical for that. So emulsification, what is this? Remember those old Dawn dish soap commercials? And they had a big greasy pan and a big old grease or fatty substance in there. They put the Dawn dish soap in there, and it broke it down into hundreds of small little globules. That's exactly what bile does. It breaks it down. That's emulsification in action. So it breaks it down and has way more surface area, and your body can break down the fat then. So it takes a big fat globule and breaks it down into hundreds, thousands of smaller ones. The trouble, so now you're going to have trouble digesting fat-soluble vitamins such as vitamins A, D, E, and K. So if you have trouble with fat, you have a gallbladder dysfunction, now you can't absorb fat-soluble vitamins very well. And obviously this D here is the most recognizable one for most people. More and more people are understanding we have to get our vitamin D levels up because they are so abysmally low in this country. Doesn't matter what state you're in either. Doesn't matter if it's Minnesota like where I'm at or California. People's vitamin D levels are way too low. And part of it is because they can't digest the fat to absorb the vitamin D to start with. Number 2, excretion of waste products, toxins. So your liver processes toxins. That's what it does. Your liver does that. We all know that, right? And then the bile, which the liver makes, grabs the toxins and brings them through the GI system till death do us part out the toilet. That's what is supposed to happen. But if you have gallbladder biliary stasis, gallbladder congestion, stones forming, liver stones forming, that bile can't move and it can't grab those poisons and bring them out to the toilet. Bile encourages peristaltic action of the intestines as well. What is peristalsis? It's the rhythmic contraction and moving along of the undigested food and fecal matter in your intestines. You kind of want that, right? You don't want to get all backed up and not go to the bathroom for 3 days. By the way, going every single day is normal. Going every other day, every third day, every fifth day, once a week is not normal. And I've seen that. I've seen patients like that, thinking it's normal. Okay, it's not normal. It's not normal for you or anybody. You need to be moving your bowels, and bile encourages that. It's very, very important. Number 3, kill off bad microbes. Right? We don't want bad microbes, and I see so many people who have parasites and funguses and small intestinal bacteria overgrowth, all these things. It's really, really nasty. See, the small intestine should not have a lot of bacteria in it. It's not supposed to. Okay? It's called SIBO, small intestinal bacteria overgrowth. Part of that's because of the liver gallbladder. Bile salts are a natural preserving agent that reduces bacterial fermentation. So if that's not occurring, if you have biliary stasis, well, now you can't get rid of these microbes. Number 4, blood sugar metabolism. If you're watching this, you have a blood sugar problem. I can almost guarantee that. If you're trusting your doctor to look at their labs, that glucose test on there, I know we run the same lab, okay, but I don't really look at it, because by the time it shows bad or you have high blood sugar on that test, you've had blood sugar issues for a long time. It's a fasting test. It's about, what, 10 hours fasting? You know, it just depends on the lab. Most people can recover their blood sugar in their blood within 10 hours. Okay, but yet they still have blood sugar issues. It's a very, very insensitive, horrendous test. It's not a good measurement of blood sugar. Most people have blood sugar issues. Bile is needed to break down fatty acids. We talked about that. Poor fat metabolism will cause blood sugar instability. So things in the body work together. They don't work one over here and one over there independently. They work together. You have to have those functions. So here's 17 symptoms of gallbladder disease. Most likely you watching this have numerous of them. Okay, most people do. Especially after age 40, you're almost guaranteed that your gallbladder is sludged up unless you've done something active to help purge it out and do certain things. Right? It's not just one thing I can just give you as a here, do this. Right? Every person is unique in how to recover their gallbladder, liver, intestinal, stomach, all these things, the function of them. Right? It's not just one thing. Number 1, nausea and vomiting. Why would you feel nauseous? Well, your bile is not flowing, and the food's coming down your stomach, goes into the small intestine, and then it's not being digested. So it just sits there. All the fat's sitting there. It's one big fat globule, right? And it's not being broken down, and you feel queasy from it. You feel nauseous. You might even vomit. Number 2, fatty or greasy stools. Because you're not digesting your fat, you're not absorbing your fat. Again, you might say, I've had people say this, hey, that's great, I want to lose weight. I want all the fat to go in the toilet. No, you don't. You want to absorb your fat that you're eating. It's so important. Get the sugar out of your diet. Right? That's going to drop your weight. Get the sugar out. You want to absorb fat. So fatty, greasy stools are a sign of gallbladder disease or dysfunction. Pain between the shoulder blades. So right back in here. Okay, especially on the right side. That's where the liver gallbladder, the same nerves that go to the liver gallbladder, go to that area as well. So people have pains in between their shoulders. It's liver gallbladder congestion, biliary stasis. It's not lack of chiropractic adjustments sometimes or other physical therapies and moves, massage. It's organ function. Number 4, abdominal pain. Kind of self-explanatory again. Right? If things aren't moving through, digesting how they're supposed to, you're going to have pain. Number 5, chronic gas and bloating. Another high sign. If you're getting bloated, you have gas all the time, that's not normal. Okay? Doesn't matter who you are. It isn't normal. If you've got gas all the time, you think it's just hilarious? It's not hilarious. It's like your body is malfunctioning. Right? It's like a fire alarm going off. Right? Some amounts of gas are normal, yeah, but not all the time. right? And it's uncomfortable, and it's not fun, right? And we're feeling bloated, not fun. 6, itchy skin. You're not getting oils to your skin. Again, fatty, greasy stools, all the fat's going out. You're not pushing the oil to your skin. You have to have oil in your skin. So what do? You go and rub a whole bunch of creams all over yourself, right? To try to get hydration to the skin. The reason you're not getting hydration to the skin and it's all itchy all the time is because you're not getting fat out to the skin. Critical. Gallbladder function. Yellowing of the skin. Jaundice. I was jaundiced when I was born. Right? That's a liver thing going on. Bilirubin. Right? It's a breakdown product. It's not being excreted. So that's a sign right there. Yellowing of the skin. Headaches and migraines. A big cause. Big cause of these. Inflammation, intestinal inflammation, liver gallbladder function. Okay? It's not up here usually. It's down here. Your body is being poisoned. And it's poisoning the nerves, blood vessels, causing headaches. Dry skin and hair, again, we talked about that with itchy skin, kind of the same thing. Okay, there's parts to it. Dry skin. Instead of trying to put lotion on yourself all the time and trying to work it that way, let's fix the inside so that your body works how Mother Nature or God intended. Chemical sensitivities, right? I was horrible with this. I couldn't be by someone smoking, nor do I really want to, but if I was forced to be in that situation, I would get sick. Cologne, perfume make me sick. All kinds of chemicals make me sick. Okay? Until I got fixed, until I got help. Right? So if you have this, and I've seen some patients who have had horrible chemical sensitivities. They're toxic. Their bodies are extremely, extremely toxic. Part of it's liver gallbladder function. Hypothyroid, the epidemic in America today. Undiagnosed or diagnosed hypothyroid. Yet 90% of it's autoimmune. Autoimmune has to do with liver as well, intestinal function, gallbladder, right? That's why these things aren't being solved. You're just getting medication for it all the time. Hypothyroid. Fibromyalgia, again, a wastebasket diagnosis. You have pain and different things going on. But a lot of it has to do with liver gallbladder function again. Hydrochloric acid function in the stomach. Very, very important. Light-colored stools, another one. Very important. If you are seeing a very light-colored stool coming out, it's because a compound is not being put in there by the liver and the gallbladder. You have biliary stasis, so it comes out really pale, almost white sometimes. That's not good. Liver gallbladder congestion. 14, weight loss resistance, liver gallbladder. You have to process toxins. Your body is not going to let you lose weight if you're full of poisons. Right? It's not just calories in versus calories out. You don't count your calories, then go to the gym and work out. That worked 70 years ago. It doesn't today. 87,000 chemicals in our environment today. It doesn't work. Right? We have to get our insides functioning. Liver gallbladder is really important for that as well. 15, skin rashes. Back to the skin again. Skin rashes, liver gallbladder. Could be intestinal as well. There's other causes. It's usually in the GI system though. The skin is a reflection of what's happening in your GI system. It's not about putting topical creams all over the place. It's the inside. IT band pain. IT band. Runners get this. So from your hip on the outside, from your hip to your knee, that's the IT band right there. Liver gallbladder congestion causes tightness to this IT band. Okay, really important to get your liver gallbladder working. So you could go do physical therapy and chiropractic and things, all kinds of things. Stretching and trying to roll out the IT band, and lo and behold, your gallbladder is all sludged up, your liver is really congested, and it's causing tightness in that IT band. Always get to the cause. Loss of hunger. The bile isn't being produced going into the small intestine. Your food's not breaking down. Things aren't moving very fast. You're not going to be hungry because food's still sitting in there. It's rotting in there. So you have a loss of hunger. Like you're full. You haven't even eaten anything, but you're full. Testing. There's various testing for this. There's lab analysis. We also use muscle testing or the bidigital O-ring test. It's very accurate for that. Like I said, lab testing as well. It's very important to get your liver gallbladder functioning, especially if you're over age 40. Probably even age 35 now. Right? More and more people, younger and younger, are getting congestion in the liver gallbladder and health is failing. Here's our office number if you have any questions or you want help with this from us. 651-982-1804. Go to the website, larsenwellnesscenter.com. You'll see different icons with different conditions there. If you don't see yours built out yet, or if you click on it, nothing happens, don't worry. I'm working on it. I'm working on videos, working on things so that you guys understand what's happening to you. When we take on a client or a patient in the office, it's all about education. Okay? I'm not here to try to do things for you. It's here to teach you how to get better and how to get your life back and keep it that way. Again, I'm Dr. Brant Larsen, and I'll see you again on a different video.